Okay, so I am here with Dr. Patricia Tidwell, who is not only a practitioner of EMDR and a psychologist, and psychiatrist, right?
No, I'm actually a licensed clinical social worker.
Like licensed clinical social worker. But not only is she a practitioner of EMDR, she was my doctor for my car accident. So I've invited you on here because I thought what happened in that room with us was so astounding that I wanted to
Mhm.
share it with other people. So before I even get into what happened with me and trauma and the car crash, I want to ask you how you first came to know about EMDR, practice it, what brought you to that?
Well, I have been practicing as a psychotherapist since 1996, so for a long time. And I would say soon after I started practicing, I'd started to hear about EMDR. But I was in training to learn psychoanalytic theory, and it really had me very absorbed. So I really wasn't that interested until several years later. Here in New York, we had Superstorm Sandy, which some people may know about. But in about half the city, the electricity went out, and I was living in half that city. And I, it was hard. I didn't realize that the other half of the city still had electricity. I was, really completely in the dark, literally and figuratively. And it was a hard time. I didn't think much of it because as a therapist, of course, I thought, oh, this is connecting to all my old stuff. I have all these childhood abandonment issues. I'm isolated. I'm alone. I completely understand that. I didn't think anything of it until a year later when I had what we call an anniversary response. I began to have flashbacks. I couldn't sleep at night. I had nightmares. I began to worry about, should I fill my bathtub up with water just in case? And I thought it was a little crazy. At the same time, I knew that it was an anniversary response. And I was talking to a colleague who actually was very experienced in EMDR at that time. And she said, you have to come to my office. You have to come. You have to let me do this. And so I did. And she did the same protocol that I did with you, which is around a recent event. And in one session, I was no longer back in that place where I was a 4-year-old child abandoned somewhere on the street in the pouring rain without electricity. I was an adult looking at it and thinking, oh, yeah, okay, it rained. And
Yeah.
it's not that I forgot how bad it was. It's just that I wasn't feeling it in the present.
And then you decided after undergoing that to learn about it.
Oh, I at that point I walked out of my friend's office and said, "Why am I not doing this for my own patients?" And I immediately went and got trained and have been doing EMDR ever since. I now facilitated trainings. I supervise new clinicians. I feel very strongly about it, and I think that as an accompaniment to a traditional talk therapy, it's incredibly powerful, either by itself for a recent event or to um, really get at the stuff that we can talk about for years, but doesn't move.
Well, I would say when I came to you, and we'll get into what EMDR is in a moment, but when I
Yeah,
came to you, I was having an inability to sleep. I was seeing the crash in my head. I told you over and over again.
yeah,
The black car kept coming into the windshield, coming into the windshield. I just couldn't get out of this cycle. I'm giving you permission, by the way, to talk about my case here. I know normally we don't do that, but I think it's interesting to go through it because I came to you and I said, I'm not sleeping. I'm having flashbacks all day, every day. I can't drive. I wasn't able to get in a car and drive. I've been
right,
driving since I was 16 years old. I couldn't even go near the corner where the accident happened because I would have these heart palpitations and I would have
right.
cortisol spikes. And I just thought, I don't know, and I also said to you, I was a war photographer and I didn't really have PTSD from that. I knew when I was going into something that there was a danger that could happen. What this
Right.
was driving down the street and some guy runs a stoplight and your whole world is literally crashed, right? And
Yeah.
that to me is why I got stuck in that moment. So talk to me, you can share whatever you want about my case. What did you see when I walked in your office?
Well, when you told me what had happened and that the experience that followed, the flashbacks, the not sleeping, I knew immediately that you were experiencing what we'd call post-traumatic stress disorder. Um, it it's kind of like you're stuck in the experience that was traumatizing. You can't leave it, and you keep re-experiencing it over and over and over again. Uh, in some cases, it's because people are triggered. You weren't triggered; you were just there, right? It's not like you needed to get in a car to have that happen.
Right.
You weren't sleeping. You were having nightmares. You were having these flashbacks, and for whatever reason, your mind didn't leave the accident when your body did. Your nervous system didn't leave. And
Well, I know that I froze in that moment. I actually froze, and I didn't scream, and I didn't cry out, and I was bleeding everywhere. I should have been in intense pain. My hand was broken. I
mhm.
just froze.
Well, when we're in a dangerous situation, we talk about this all the time. It's fight or flight, right? And you weren't in any position to fight. You were telling me how much blood you had in your mouth. You couldn't speak, much less yell at the guy. And you couldn't flee because you had been injured. Plus, that wouldn't have been a very useful thing to do at the time. But what happened, and we don't talk about it that much, is that you froze. That's really when trauma happens, is in the freeze, because you can't save yourself if you're frozen.
Right.
It's an automatic unconscious response. Little animals do it, when they play dead. It's
Hmm.
essentially kind of what our system does if we freeze. Part of what happens in that moment, if you're frozen, though, is that the information can't get integrated and processed. So you know that you're not in the car anymore, but your nervous system is saying that you're still in the car. It's happening over and over again. And it's kind of like the cognitive piece that's over here and the emotional implicit piece that's over here are still separate. They don't get to go like that. And EMDR helps that happen.
Now, how does it work? Okay, I will tell everybody what happened when I walked into your office. I can't do the flashing lights, which is what classical EMDR is, because I get migraines.
Right.
So we did buzzing in the hand. So there was two little
Like pulsars.
pulsers in my hand, and they would go right, left in this very steady way.
Yeah.
And as these pulsars were going on, you asked me to go through that entire day. What happened that day of the accident?
Right.
Why?
Yeah. Because the story, particularly if it's a single incident like that, that's recent, the story's still very much in the present. It
Right.
hasn't gotten in. It's not 5 years ago. It's not 20 years ago. It's when we met, it was a month later,
Hmm.
right? So it's still very present. So the idea is to just go through the day so that from the story from the beginning, whenever it starts, up until the moment that we're meeting, because it's a way of actually beginning to process what happened during the day. The idea is to help avoid it going into, long-term memory and needing to be processed differently. So,
And what is it about the buzzing or the light flashing that is rewiring the brain? Because when I walked out, how many sessions did we do? 3? I mean,
yeah.
I felt completely revived. I would use that word, revived after 3 sessions of EMDR. What's happening in the brain? I'm so confused about that.
Well, the truth is, I don't think we really know what the buzzing does to the brain. What we do know is what we call bilateral stimulation, which is the alternating sides of the buzzing, or when your eyes go back and forth like that. There's some way in which some people say it relaxes the brain, so that rather than having this sort of wall up between the cognitive information and the implicit information, it's more, I don't, I hesitate to use some non-medical language because I don't know the medical stuff, but it's almost as if it becomes the boundary becomes more porous and they can connect to each other. I really think about the idea of it's being like that and then it goes like that because our emotions help us understand what is going on cognitively. It gives it shape and color and perspective. And our cognitive information helps order and analyze all of our emotional information. We really need the two to work together. And they get separated in a trauma.
Right. Well, what was interesting for me was and I told you this, a few weeks after the car crash, I was with my boyfriend in the car and we, again, a car came out of nowhere.
Right.
We almost got hit and I screamed and cried and was, my reaction was intense, but it was kind of like the reaction that I should have had at the car crash.
Absolutely.
And then I, again, felt much better. And it was
Mhm.
post EMDR. And then, I read that, when animals get attacked, they literally shake it off. And that
Yeah,
shaking it off is what allows them to move forward without living in that.
absolutely. Yeah. Well, EMDR kind of in this particular instance kind of helped you shake it off. So then when you have this experience, because it's not the same experience, but that it's almost like it was a trigger for you because of the way the car went by.
Yeah.
You could have the response that you should have had before. And had you had it before, you might not have been quite so traumatized. It still would have been a horrible experience. It
Right.
doesn't undo that,
Right.
right? But you may not have had the same kind of flashbacks or nightmares. You might have had some, but not to the extent that you were having.
So I would say that the trauma is completely gone, except for one thing we talked about this last week, which is that when I'm on a road and there's a black car coming from the right side, it doesn't matter if it's coming from the left side. I don't care about the left side. I don't get
Right.
triggered. When it's coming from the right side and it's black and it's an SUV, I have a rush of cortisol.
Right.
So I guess that's just going to take time.
Well, it could. The other thing is that you could have another EMDR session just on that to see if it makes it go away.
Okay.
Because it could.
All right. Well, well, the other thing I wanted to ask you about is, so in traditional trauma therapy, pre-EMDR, and
Yeah.
I did traditional trauma therapy, you go week after week after week after week, and you tell the same story over and over and over again. I'm still fascinated and still don't understand, and I know maybe nobody understands why it is that when you have buzzers in your hand and you tell the same story that would have taken years to process in traditional therapy takes 3 sessions. And I also
Well,
think that's fantastic too.
but what you processed in 3 sessions is not what you were processing in your traditional talk therapy.
Right.
And the place of the trauma is very different in your personal story.
Right.
The car accident happened. It didn't involve people that you knew.
Right.
It didn't become part of the weave that you have with family or
Right.
loved ones or anybody other than the guy who hit you and some of the people who weren't very nice or
Yeah.
were kind of uncaring, but nonetheless.
Right.
Part of what happens is talking is just that, it's talking. It doesn't always get to the part of an experience that we don't have words for. If you think about any memory that you have, most of the time we're able to visualize it. And we can say this happened and it was fun and it was dark out or somebody was laughing. And at the same time, we may be essentially running a movie in our heads, but we aren't putting words to the details.
Right.
So if you were doing something that was historical in EMDR, you might then say, what's the picture of the part that's the most disturbing? And that could be the look on somebody's face. It could be the fact that it's dark out and you can't see. It could be any number of things. And then I ask what the emotions are that are coming up. And then I ask what's the body sensation that goes with that?
Right.
And all of that comes together. And, what are the negative voices in your head saying about you? Because trauma survivors are full of self-blame. It's my fault, or I'm going to die. Any number of those phrases. First of all, a child is never responsible for anything that an adult does, ever.
Right.
But that doesn't mean that they don't believe that. So that's part of what gets processed.
Oh, yeah. I mean, even in my car crash, I kept going through the day in my mind, like, oh, if only I hadn't grabbed the umbrella, if only I hadn't gone back into the apartment, all these things that I could have done, which would have put me a millisecond behind or above. And that also is gone now that I did the EMDR.
Well, thank goodness, because that's not what caused the
Right.
the crash.
Right. But the rumination
Yeah,
or ruminations in general go along with trauma hand in hand often.
absolutely. They're trying to resolve it, trying to figure it out, and that's part of what EMDR can address. It's not direct. It's not like you say, how are we going to stop these ruminations? It's processing the actual experience that then the need to ruminate is no longer there.
And how many of your patients come to you with EMDR needs that are sort of very present and happen recently? And what is the percentage perhaps of people that come to you with, horrible things that happen in childhood?
Well, I'd say in my practice, it's more the latter. It's more what I would call developmental trauma that happens in childhood that then has a tremendous influence on how you lead your life.
Right.
That said, periodically there'll be moments when I get a larger group of people who come in with recent events. The last 3 years is a really good example because we had so many people who were in New York who were traumatized, particularly in 2020 and 2021.
Oh, Adley Smart. Yeah, I remember talking to my primary care provider. I got COVID in March of 2020, right away.
Yeah.
I couldn't breathe. And I said, I got to come to the hospital. I got to come to the hospital. And he's like, don't come to the hospital. I had 19 of my patients die last night. Like, don't come
Oh my
here.
God.
Yeah.
Yeah.
And I just kept thinking, oh my God, what these people went through
Yeah.
to have all of your patients die because there was nothing you could do. There was no PPE. They were wearing trash bags.
Yeah.
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 Insane. Well, listen, I don't have other questions. I think that I wanted to just sort of have a small conversation with you to kind of
Sure.
talk about this. If you have other things you want to talk about in terms of EMDR that I've missed in asking, I would love to hear them.
Well, I think that one of the most important things to think about in terms of EMDR, because there's a lot of buzz around it right now, and the buzz doesn't go along with any description of what's going on. The buzz is if you've had some trauma, EMDR is the thing to do, and it doesn't take long. Well, that potentially is true. It's not 10 years of EMDR, even if it's a long-term EMDR treatment. It's not years and years and years. It might be a year and a half, maybe 2. But that's for somebody who's got a lot of historical trauma.
Mm-hmm.
But it's not easy, right? There's tremendous relief when it's over, and for me, and I think from what you're saying, it was really a life-changing experience.
Absolutely life-changing. Yeah.
Right. And it is, but at the same time, in the process, it can be challenging. And I don't say that to dissuade anybody from coming, but I find recently, because there's been all this buzz, that people come in and they say, okay, well, let's do it. And we start to,
Yeah.
they start to do it. And first of all, they didn't realize that they might have to do something. And second of all, that actually you have to go through the painful stuff.
Oh, yeah.
To get to the other side.
Oh, I want to actually talk to that specifically,
Yep.
which is when I did my first session with you, I mean, I was hysterically crying. There was a lot of emotional output, let's call it. And then you said to me, you might want to take it easy for the rest of the day. It's going to be hard. And I thought, oh, I'm fine. And I actually ended up wandering the streets of New York, kind of unable to not even figure. I knew where I was, but I wasn't ready to go home. and I wasn't
Mhm.
ready to sit, and I wasn't ready to eat. And I ended up walking nearly all the way home. And then I got a city bike when I got tired, but I just kind of walked all the way through Manhattan, over
Mhm.
the Brooklyn Bridge, and my mind was kind of stuck in that
It
session,
was
going
still
over and over
processing the
and over. Yeah,
material.
yeah.
Yeah.
It was really intense. The next session was less traumatic, and the third, each session was
Yeah.
progressively less traumatic. And also, we're only talking about a moment of trauma. We're not what you
Yeah.
said, like we're not talking about a childhood of trauma. We're talking about that
Right.
one moment that I could not shake. Anyway, Dr. Tidwell, thank you so
Oh, my pleasure.
for talking to me. And I'm going to press stop on this and stay on for a second.
Okay.
Oh, stop. Wait, hold on. Stop recording.